and administration. Contraindications: decreased LOC, lack of gout reflex, dysphagia, vomiting. Place PT in high Fowler's position. Do not mix meds with large amounts of food. Do not crush and tear coated or extended release meds for liquid meds. The base of the meniscus should be the level of the order dose. Sublingual buccal. Place under tongue between cheek and gum. Do not eat or drink until dissolved. Patient transfer. Use bar situation, background assessment recommendations. Patient discharge. Diet activity restrictions. Detailed instructions for procedures at home. List of meds, when to take them, precautions for them, signs, symptoms of complications, when to seek medical attention, follow-up appointment info, names, numbers of providers and community resources. Balance assessment. Romberg test. Have PT stand with hands at side and eyes closed, heel to toe walk. Stereognosis. Put familiar object in PT's hand and ask them to identify it. Graphesthesia. Trace a number on a patient's hand, ask them to identify it. DTRs. 4+ brisk, clonus 3+ above average, 2+ normal, 1+ diminished, 0 no response. GCS. Temperature. Taking a rectal temperature. Place PT in Sims position. Use loop. Insert 1-1.5 for adults. No rectal temp for babies under 3 months old or PTS with high bleeding risk. Taking tympanic temperature. Adults up and back, children under 3 down and back. Excess airwax can affect temp. Taking temporal temp. Slide probe across forehead to hairline. Touch soft depression behind ear. Pulse pressure. SPPDVP. Blood pressure. Hyperthermia. Over 39 degrees Celsius. Obtain blood cultures, specimens, admin, antibiotics, antipyretics, fluids as ordered. Prevent shivering. Provide blankets if PT is having chills. Hypothermia. Under 35 degrees Celsius. Provide warm blanket. Warm for fluids. Increase room temp. Keep head covered. Endotracheal suctioning. PT education. Foods that affect medication. Fluid volume excess. NG tubes. Injury prevention in school-age children. Use car booster seat while child is under 9 inches or under 40 pounds. Use protective gear for bicycling, sports. Reduce water heater settings to less than 120 degrees Fahrenheit. Keep guns locked up. Bullets stored in a separate location. Enclosed pools with locked fence. Supervise children. Stages of wound healing. Inflammatory stage, vasoconstriction, clot formation, hemostasis, phagocytosis of microorganisms, proliferative stage, replacement of lost tissue with granulation tissue and collagen, wound contraction, wound resurfacing, maturation stage, remodeling and strengthening of collagen tissue. Inflammation. Key points for administering restraints. During seizure. Lower PT to floor or bed. Turn PT on side. Loosen restrictive clothing. Do not restrain or put anything in their mouth. Note onset and duration of seizure. After seizure. Take versus perform neurochecks. Reorient PT. Identify possible trigger. Implement seizure precautions. Herpes zoster. Herpes zoster. Caused by reactivation of varicella zoster virus. Risk factors: compromised immune system, stress, infection. Fluid volume deficit. Fluid volume deficit. Absorption. How meds get from location of administration to bloodstream affected by route of administration. Absorption of PO meds is slower because meds must go through GI tract. Absorption depends on solubility of med, presence of food in stomach, GI, pH, form of med. Radial pulse. Take on thumb side of wrist. Regular 30 seconds, irregular 1 minute. Pulse deficit. Difference between apical pulse rate and radial pulse rate. Triage. Class 1, immediate threat to life, breathing issues, hemorrhagic wound, major burns. Class 2, major injury that requires treatment. Class 3, moderate injury does not require immediate treatment. Class 4, expected and allowed to die. Nurse actions during disasters. Injury prevention for toddlers and infants. Respirations. Normal equals 12-20, adults 35 to 44, infants 20 to 34, school-age children. Assess rate, depth, rhythm when chemoreceptors in body detect rising CO2 levels. Respiratory control center in the brain increases respirations. How to take. Place PT in semi-Fowler's. Place hand on abdomen. Air assessment. Distribution. How medication gets from bloodstream to site of action affected by circulation permeability at destination site. Protein binding meds need protein to travel to site of action. Availability of protein and competition for protein binding sites with other meds can affect distribution. Lung assessment. Percussion, expected resonant, unexpected, dullness, hypersonance, auscultation, expected, bronchial, bronchovascular, vesicular, unexpected, crackles, wheezes, pleural, friction, rub. Wound healing. Stage 1 non-blanchable erythema. Stage 2 shallow ulcer, pink red moist wound bed, no slough. Stage 3 deeper ulcer, no exposed muscle, bone, tendon. Stage 4 deep exposed muscle, bone, tendon, unstarchable, Escher, slough covers wound bed, cannot determine wound depth. Sodium 135 to 145 mcl. Sodium's function in the body. Maintains fluid balance in body, nerve, and muscle functioning. Hyponatremia. Cause: GI losses, diuretics, skin loses, SIADH, edema, hyperglycemia. Symptoms: tachycardia, hypotension, confusion, fatigue, and headache. Hyponatremia. Causes: water deprivation, excess sodium intake, kidney failure, Cushing syndrome symptom, tachycardia, muscle twitching weakness, GI upset, edema. Potassium. 3.5-5.0 mg/kg. Potassium function in the body. Maintains ICF nerve function, regulates muscle and heart contractions. Hypokalemia. Causes: GI loss, diuretics, skin loss, metabolic alkalosis symptoms, dysrhythmias, muscle weakness, cramps, constipation/ileus, hypotension. Hyperkalemia. Causes: uncontrolled diabetes, metabolic acidosis, kidney failure, salt substitute symptoms, dysrhythmias, muscle weakness, numbness, tingling, diarrhea, confusion. Stages of grief. Denial, anger, bargaining, depression, acceptance. Heart assessment. All physicals eagerly take money: aortic, pulmonic, Erb's point, tricuspid, mitral. Anticipatory grief. Grief experienced prior to a loss. Complicated grief. A person has a prolonged or significantly difficult time moving forward after a loss. Maturational loss. Loss, usually of an aspect of self, resulting from the normal changes of growth and development. Situational loss. Experienced as a result of an unpredictable event. Oxygen safety. Place no smoking sign, use cotton bedding and clothes, make sure electrical equipment is grounded, no extension cords, no nail polish. Alarm reaction stage. Also the flight response, heart rate and BP increase, cortisol is released, boost of adrenaline. Resistance stage. Second stage of the stress response, body attempts to return to normal, normalizes hormone levels and versus. Exhaustion stage. It occurs when stress is prolonged and beyond the person's control. Result is illness, fatigue, and depression. Removing sutures. Grasps knot with forceps, cut suture close to skin, pull out suture in one piece. Screenings and assessments. Irrigation of wound. Use 30-60 ml syringe, 5 to 8 psi pressure. Wound cleaning. Clean from least to most contaminated. Dehiscence. Partial or total separation of wound layers. Evisceration. The displacement of organs outside the body. Nurse interventions. Place soaked sterile towel dressing over wound and protruding organ. Do not reinsert organ. Place PT in supine position with hips and knees bent. Keep NPO for surgical intervention. Calcium. 9-10.5. Calcium function in the body. Bone teeth formation, nerve and muscle function, clotting. Hypocalcemia. Causes: diarrhea, Vit-D deficiency, hypoparathyroidism symptoms, plus Kvistax plus Trucy sign, muscle spasms, numbness, tingling in lips, fingers, GI upset. Hypercalcemia. Causes: hyperparathyroidism, long-term steroid use, bone cancer symptoms, constipation, decreased DTRs, kidney stones, lethargy. no cranial nerves and how to test them. Three stages of inflammation. First stage, erythema, warm, edema, pain at site of injury. Second, WBC, kill microorgs, exudate containing WBC and dead tissue cells accumulate at the site. Exudate may be serous, sanguineous, serosanguineous, or purulent. Third, damaged tissue is replaced by scar tissue. Systemic versus local infection. Systemic fever, chills, malaise, fatigue, increased RR, increased pulse, local edema, pain, erythema, warmth in particular area of body. Lab tests that indicate infection: WBC greater than 10,000, left shift ESR greater than 20, CRP greater than 3. Positive culture result: get culture before starting antibiotics. Stages of infection. Incubation time from when pathogen enters the body until the first symptom appears. Prodromal time from onset of general symptoms to specific symptoms. Illness-specific symptoms occur. Convalescent symptoms disappear to complete recovery. Chain of infection. Causative agent, reservoir, portal of exit, mode of transmission, portal of entry. What is virulence? Ability of pathogen to produce disease. Active natural immunity, active artificial immunity, passive natural immunity, passive artificial immunity. Non-specific innate immunity versus specific adaptive immunity. Airborne precautions, droplet precautions, contact. Airborne measles, varicella, TB, private room, negative airflow room, N95 masks, droplet influenza, pneumonia, pertussis, mumps, sepsis, rubella, back meningitis masks, contact impetigo, scabies, MRSA, V, diff, RSV, wound, private room or other PT with same infection, gloves and gowns. TF, do not put up all four side rails for PTS who will try to get out of bed on their own. True. Apply restraint so fingers can fit between restraint and patient. Use quick release knot. 2. Race in PASS. Rescue, alarm, contain, extinguish, pull pin, aim at base of fire, squeeze handle, sweep from side to side. Foods that can cause choking in infants and toddlers. Grapes, raw carrots, hot dogs, celery, peanut butter. For school-age children, reduce water heating setting to less than blank degrees Fahrenheit. 120. Airway, breathing, circulation, disability, LOC, exposure. First aid, bleeding, fractures, sprains, frostbite, burns. Pressure to wound, splint, neurovascular assessment, rise 98.6 to 108 degree, water to warm up, tetanus, removes agent, elevate extremities, fluids and tetanus. Screening, assess colorectal screen. Start age 50, fecal 1, sigmoid 5, colonoscopy 10 years. Pap smear. Every 3 years after 21. Mammogram. Annual after 40. Testicular exam. Routine health check starting age 20. PSA-DRE. Annual starting age 50. 6 ethical principles. Autonomy, beneficence, noun, maleficence, justice, fidelity, veracity. 5 rights of delegation. Right task, right circumstance, right person, right direction, communication, right supervision, evaluation. What is included in the general survey? Physical appearance, age, race, gender, LOC, sign of substance abuse, distress, body structure, height, weight, nutrition, posture, obese, abnormalities, mobility, gait, ROM, movement, behavior, mood, speech, grooming, vital signs. Pulse deficit. Difference between the apical and radial pulse rates. Blood pressure classifications. Normal 120/80 prehypertension 120-139/80-89 stage 1 140-159/90-99 stage 2 greater than 160/ greater than 100 decimeters or kidney disease will TX in prehypertension. Orthostatic hypotension. Take BP in supine position, sit patient up and wait 2 to 3 minutes. Take PT-BP sitting, stand patient up and wait 2 to 3 minutes. Take BP standing positive. SBP decrease greater than 20, DBP decrease greater than 10 with 10 to 20% increase in HR. Pulse pressure. SBP-DBP. Bladder of BP cuff should surround blank % of arm circumference. 80. Changes with older age, eyes, ears, mouth, voice, noise. Eyes, decreased vision, yellow lens, issue with glare and darkness, ears, hearing loss, thickening of tympanic membrane, mouth, decreased sense of taste, gum disease, tooth loss, decreased salivation, pale gums, voice, increased vocal pitch, nose, smell, decreased. Thrills. Vibration associated with murmurs or other cardiac abnormalities. Brutes. Swishing sounds caused by turbulent flow. Cardiovascular changes in old age. Increase BP, blood vessels thicken, heart and pulse pressure increases. Primary lesions. Secondary lesions. Crust, scab, erosion, ruptured vesicles, scale, dandruff, eczema, fissure result of too dry, moist skin, ulcer, pressure injury. LOC. Alert, lethargic, falls asleep easily, obtunded, responds to light shaking, but confused and slow to respond, stupor, barely responds to painful stimuli, confused and slow to respond, rump, sternum, comatose. Glasgow Coma Scale. Shows the levels of consciousness score between 3 and 15. I verbal motor. Maturational loss versus situational loss. M. Loss expected with normal life. S. Unexpected external event. Anticipatory grief versus complicated grief. A. Grief before an actual loss. E. Grief prolonged, severe, interferes with normal function months after loss. No acceptance after 6 months. Stages of grief. Denial, anger, bargaining, depression, acceptance. Palliative versus hospice care. P. Interventions focus on symptom relief, can be given at the same time as treatments to cure disease or during end-of-life. H. For patients with a terminal illness not expected to live more than 6 months, focus is on symptom relief, not curing disease. Signs of impending death. Abnormal breathing, decreased LOC, decreased muscle tone, modeling of skin with cool extremities, decreased pulse and BP, incontinence and decreased urine output, increased secretions in airways, hearing acuity not decreased during this time. Sleep cycles. Sleep apnea. Greater than 5 incidents of breathing cessation in an hour of sleep, each one lasting greater than 10 seconds. Use of CPAP. Water-soluble vitamins. Fat-soluble vitamins. Water C complex feta D, E, K. Newborn nutrition. Breast milk or formula for first year. Solid foods introduced at 4 to 6 months. No cow's milk or honey until 1 year old. BMI ranges. Underweight less than 18.5, normal 18.5-24.9, overweight 25-29.9, obese greater than 30. Dysphagia. Difficulty swallowing. 3 stages of general adaptation syndrome. Alarm resistance, exhaustion. Symptoms of deep vein thrombosis. Unilateral edema, pain, warmth, erythema in leg. Intervention: elevate leg anticoagulants, avoid pillow underknees, crossing legs, wearing restrictive clothing, sitting for a long time, massaging legs. Perform exercise every 2 hours. Ankle pumps, foot circles, knee flexion. Key points for dysphagia. Thick and thin liquids. Check for food pockets. Tuck chin when swallowing. Nociceptive pain versus neuropathic pain. Nociceptive due to tissue damage or inflammation, aching and throbbing. Localized neuropathic burning, shooting, pins, needles, damage to nerves and body. Phantom limb. Diabetic neuropathy. Treat with antidepressants, anticonvulsants, muscle relaxers. Correct use of cane. 2 points of support on ground at all times. Position cane on stronger side of body. Body weight both legs. Cane 6 to 10 in front. Weak leg forward, then stronger leg past the cane. Correct use of walker. Do not use to stand up. Flex elbows 20 to 30 degrees. Advance 12 inches. Weak first, then strong leg forward. Correct use of crutches. 3 finger widths between axilla and top of crutch. Elbows flex 30 degrees. Walking. Start in tripod position. Advance both crutches and the injured leg, then move unaffected. What is idiopathic pain? Chronic pain of unknown origin, often associated with depression. Antidote for opioid. Naloxone. Fecal occult blood test. Tests for blood in stool. Collect 3 samples from 3 different BMs. Do not allow contamination with water. Urine for point of care testing. Blue color indicates positive result. Insert tip for enema. cm raise back cm above anus. 7.5 to 10 cm, 30 to 45 cm above anus if patient is cramping. Slow flow by lowering bag. How to change an ostomy pouch. Remove pouch. Inspect stoma and skin. Clean skin with soap and water. Dry thoroughly. Do not use moisturizers. Cut opening in skin barrier less than equals 1/8 thin. Larger than stoma. Apply skin barrier and pouch using barrier paste as needed for creases. Symptoms of dehydration. Increased pulse rate, hypotension, poor skin turgor, elevated temp, dry mucous membranes. Inability to reach bathroom in time due to overactive detrusor muscle. Urge incontinence. Urinary elimination. Output less than 30 milliliters per hour needs to be reported to provider. Fluid intake should approximately equal urine output. 24-hour urine collection. Discard first. Avoid. Collect all urine for 24 hours. Do not allow contamination with stool. Keep urine on ice. Foley catheter care. Clean insertion site with soap and water 3x day and after BMs. Keep collection bag below level of bladder. Make sure tubing is not kinked. Hearing loss and aphasia. Conductive versus sensorineural hearing loss. Pharmacokinetics. Absorption, distribution, metabolism, excretion. Absorption. How med gets from location of admin to bloodstream route oral, sub-Q, IM, sublingual buccal. For absorption with PO meds is slower because med must go through GI tract. Absorption depends on solubility of meds, presence of food in stomach. GI telephone form of med. Distribution. Metabolism. Excretion. Elimination of meds from body primarily done through kidneys but also liver, lungs, intestines affected by kidney dysfunction can impair excretion of meds, leading to possible toxicity, more common in older adult. Therapeutic index and half-life. Agonist versus antagonist. Agonist activates receptor in body. Antagonist medication that blocks a receptor in the body. Oral meds. Do not mix with large amounts of food. Do not crush and tear. Coated extended release for liquid meds. The base of the meniscus should be at the level of order dose. Transdermal administration. Wash skin with soap and water. Dry thoroughly. Place patch on hairless area. Rotate sites. Use gloves. Optic drops administration. Rest dominant hand on PT forehead. Drop med into CO1J sac without touching eye with a dropper. Apply gentle pressure to nasolacrimal duct for 1 minute. Wait 5 minutes between DeFi drops. Otic drops. Lay PT on unaffected side. Pull auricle up and back for adults, down and back for children under 3. Hold dropper 1 cm above ear canal. Install then gentle pressure on tragus. PT should remain on site for 2 to 3 minutes. MDI DPI. MDI, shake inhaler. DPI, do not shake device. Hold breath for 10 seconds. NGG tube med admin. Administer each med separately. Dissolve tablets in 15 to 30 ml sterile water. Flush tube before and after each MED with 15 to 30 ml water. IM injections admin. Use 1-1.5 in 18 to 27 gauge needle. Use fastest lateralus for infants less than equals 1 year old. Volumes over 2 ml. Ventrogluteal site, deltoid site limited to volume up to 1 ml. Inject at 90-degree angle with C-track method. Intradermal med admin. Tuberculin syringe 26 to 27 gauge, small volume 0.01 to 0.1 ml. Insert bevel up at 10 to 15-degree angle. Observe for small bubble and do not massage the site. Sub-Q admin. 3/8-5/8 inch 25 to 27 gauge needed, or use insulin syringe 28 to 31 gauge if admin insulin. Inject volumes up to 1.5 ml in fatty areas at a 45 to 90-degree angle. Use 90-degree angle for obese patients. Key points with insulin admin. Never mix long-acting insulin clear before cloudy. Inject air into longer-acting insulin, air into shorter-acting, draw up clear, shorter-acting, draw up longer-acting, cloudy. Pregnancy categories for medication admin. 10 Rights of SafeMed Admin. Right. Patient medication dose time route documentation patient education refuse assessment evaluation. Error-prone abbreviations that should not be used. MS-04 for morphine, Mg-SO4 for magnesium sulfate, decimal points without leading 0 trailing 0 IU for units, QD for daily COD, QOD for every other day, SC, SQ, SUBQ for subcutaneously. Key conversions. 1 mg equals 1000 mcg, 1 gram equals 1000 mg, 1 kg equals 1000 grams, 1 ounce equals 30 milliliters, 1 teaspoon equals 5 milliliters, 1 TBSP equals 15 milliliters, 1 TBSP equals 3 teaspoon, 1 kilogram equals 2.2 pounds, 1 grain equals 60 milligrams. Catheter sizes. 16 gauge for trauma patients, 18 to 20 gauge for surgery PTS or those receiving blood, 22 to 24 gauge for other patients. For care. Maintain for patency by flushing with NS every 8 to 12 hours when PTISNT receiving continuous for infusion, change for sites according to facility policy, replace for tubing according to policy, wipe all ports with alcohol or antiseptic before connecting lines or a syringe. Discontinuing IVs. Elevate arm and hold pressure for 2 to 3 minutes. Make sure catheter tip is intact. 5 for complications. Adverse effects of meds. Extrapyramidal anticholinergic orthostatic hypotension, bleeding. Extrapyramidal symptoms. Dystonia, akathisia, Parkinsonism, tardive dyskinesia. Anticholinergic effects from meds. Urinary retention, constipation, dry mouth, blurry vision, photophobia, tachycardia, patient teaching, increase fiber and fluid intake, wear sunglasses outside. Orthostatic hypotension, adverse effect of meds. Lightheaded/dizziness when standing up, patient teaching, change position slowly. Bleeding effects from meds. Coffee ground emesis, tarry stools, bruising, petechiae, bleeding gums, oozing blood from foresight. Foods that affect meds. Grapefruit juice, foods high in vitamin K, high protein foods, tyramine-rich foods, potassium-rich foods, dairy. Diabetes, blood glucose. Bg greater than 200 mg per deciliter equals hyperglycemia. Bg less than 70 equals hypoglycemia. Urine glucose testing used to test for ketones in the urine, recommended for diabetic patients during times of illness, stress, or when they have a blood glucose greater than 240. Hypoxemia symptoms. Early restlessness, irritability, tachypnea, tachycardia, increased BP, pallor, abnormal breathing, late decreased LOC, bradycardia, dysrhythmias, bradypnea, decreased BP, cyanosis. Oxygen delivery. Nasopharyngeal and nasotracheal suctioning. Endotracheal suctioning. Tracheostomy care. NG tube insertion. High Fowler's towel across chest, water-based lubricant, sip water while inserting NG tube, withdrawal slightly if patient gag, choke, check placement by checking pH of gastric contents, confirm placement with chest X-ray. How often do you measure gastric residual with NG tubes? Every 4 to 6 hours. Return residual to stomach. Hold feeding for residual amount over hospital policy. When do you flush feeding tubes? Flush NG tube with 30 ml water every 4 hours. Enteral feeding tubes. Cover and label unused formula with patient information. Refrigeration for up to blank hours. 24. Fill enteral feeding bags with only blank hours worth of formula to prevent bact contamination. 4. Phases of wound healing. Inflammatory, vasoconstriction, clot formation, hemostasis, phagocytosis of microorganisms, proliferative, replacement of lost tissue with granulation tissue and collagen, wound contraction, wound resurfacing, maturation, remodeling and strengthening of collagen tissue. Intentions of wound healing. Primary intention, wound edges approximated, heals quickly, minimal scarring. Secondary intention, wound edges widely separated, longer healing time, scarring, increased infection risk. Tertiary intention, wound left open to address infection and then closed at a later time. Factors that delay wound healing. Older age, decreased immune function, impaired nutrition, decreased perfusion, smoking. Wound appearance. Red equals healthy wound bed, yellow equals presence of slough pus, black equals presence of Escher. Wound drainage. Serous, sanguineous, serosanguineous, purulent. Wound cleaning. Clean from least to most contaminated. Irrigation, use 30 to 60 ml syringe, 5 to 8 thigh of pressure. Dehiscence versus evisceration. Pressure injury staging. 1. Non-blanchable erythema. 2. Shallow ulcer, damage to epidermis, pink red moist wound bed, no slough. 3. Deeper ulcer, no exposed muscle, bone, tendon. 4. Deep, exposed bone, muscle, tendon, unstoppable. Escher slough covers wound bed, cannot determine depth. Symptoms of fluid volume deficit. Tachycardia, tachypnea, hypotension, weak pulse, fatigue, weakness, thirst, dry mucous membranes, GI upset, oliguria, decreased gain, turgor, decreased cap refill, diaphoresis, flattened neck veins. Lab results for FVD fluid volume deficit. Increased HCT, increased serum osmolarity, increased urine-specific gravity, hyponatremia. Symptoms of fluid volume excess. Tachycardia, tachypnea, hypertension, bounding pulses, weight gain, dyspnea, crackles, edema, jugular vein distension. Lab results for fluid volume excess. Decreased HCT, serum osmolarity, urine-specific gravity unless SiADH, electrolytes, BUN, creatinine. Sodium function in body. 136 to 145 mg/L maintains fluid balance in the body, nerve and muscle function. Hyponatremia. Less than 136 causes GI loss, diuretics, skin losses, SiADH, edema, hyperglycemia. Symptoms: tachycardia, hypotension, confusion, fatigue, envy, headache. Hyponatremia. Greater than 145 mg/L causes water deprivation, excess sodium intake, kidney failure, Cushing syndrome. Symptoms: tachycardia, muscle twitching, weakness, GI upset, edema. Potassium function in body. 3.5-5.0 maintains ICF, nerve function, regulates muscle and heart contractions. Hypokalemia. Less than 3.5 mg/L causes GI losses, diuretics, skin losses, metabolic alkalosis symptoms, dysrhythmias, muscle weakness and cramps, constipation, ileus, hypotension. Hyperkalemia. Greater than 5.0 mg/L causes uncontrolled diabetes, metabolic acidosis, salt substitutes, kidney failure symptoms, dysrhythmias, muscle weakness, numbness, tingling, diarrhea, confusion. Calcium levels and function in body. 9 to 10.5 mg per deciliter. Bone teeth formation, nerve and muscle function, clotting. Hypocalcemia. Less than 9 mg per deciliter causes diarrhea, vitamin D deficiency, hypoparathyroidism symptoms, positive Fostex and Trousseau signs, muscle spasms, numbness, tingling in lips, fingers, GI upset. Hypercalcemia. Greater than 10.5 mg per deciliter causes hyperparathyroidism, long-term steroid use, bone cancer symptoms, constipation, decreased deep tendon reflexes, kidney stones, lethargy. Magnesium levels and function in body. 1.3-2.1 mg/L. Nerve and muscle function, bone formation, critical for many biochemical reactions in body. Hypomagnesemia. Less than 1.3 mg/L causes GI losses, diuretics, malnutrition, alcohol abuse symptoms, dysrhythmias, tachycardia, hypertension, tremors, seizures, increased DTRs. Hypermagnesemia. Greater than 2.1 mg/L causes kidney disease, laxatives containing Mg, symptoms, hypotension, muscle weakness, lethargy, respiratory and cardiac arrest. The nurse should use a blank ml syringe to irrigate the wound. Syringes that hold 30 to 60 milliliters of fluid create a safe but effective amount of pressure for wound irrigation. 35. The nurse should flush the feeding tube with ml of sterile water before administration and between each medication. The nurse should flush the feeding tube with blank ml of sterile water following the administration of the last medication. 15-30-30-60. Role blank occurs when a person is unclear about the expectations of his role in a given situation. Ambiguity. Skin blanching, edema, and coolness at the IV site indicate blank. Infiltration. Bed bath. Gloves. Whilst locked on bed, wash face first. Wash one area at a time. Perform perineal care with clean water. Perineal care. Maintaining skin integrity, provide privacy, maintain professional demeanor, remove any fecal matter, cleanse from front to back, dry thoroughly, retract foreskin to wash tip of penis. Foot care. Inspect feet daily, pay attention to between the toes, lukewarm water, dry feet thoroughly, apply moisturizer, avoid over-the-counter products, wear clean socks, check for objects, cut nails straight across, apply lotion and powder. Oral hygiene. Have suction ready at side the bed, remove dentures, brush them with soft brush and denture cleaner, rinse them, store in denture cup with water to keep moist, help reinsert. Shaving. Safety. If prone to bleeding, use electric razor, apply soap shaving cream, move razor over skin in direction of hair growth using long strokes on large areas and short on small areas. Communicate. What factors put a pine at risk for falls? age, developmental status, mobility, balance, knowledge about safety risks, sensory cognitive status, communication skills, homework environment, community. How should a nurse assess for home safety risks? Identify risk factors, nursing checks, physical exam, home hazard appraisal. Aspiration risk. Small objects out of reach, check toys for small parts, sharp edges, no hard candy, peanuts, popcorn. Don't place infant in supine position for feeding or prop their bottle, one-piece pacifiers. Who should use a booster seat in a car? Kids less than 4 feet 9 inches and weigh less than 40 pounds. When can kids sit in the front seat? When they are older than 12 years. When should a rear-facing car seat be used? For children until 2 years old or until they exceed the height weight limits. How to prevent falls at home. Removing throw rugs or loose carpets, placing electrical cords, extension cords against the walls behind furniture, place grab bars near toilet tub or shower, stool riser, non-skid mat in tub shower, shower chair or bedside commode, lighting is adequate, step sidewalks in good shape. How to prevent O2-caused fires at home. Place a no smoking sign outside the house and near PTS room. Ensure electrical equipment is in good shape while grounded. Reduce bedding that can generate static electricity with cotton sheets. Keep heating oil or nail polish remover away from oxygen. Have a known exit route. Bioterrorism. Putting harmful toxins, bacteria, viruses, pathogens into the air with the intent to cause illness, death. What are bioterrorism agents? Anthrax, variola, C. botulism, Yersinia pestis. What is a primary survey? Assessment in 60 seconds or less to determine life-threatening conditions, done with standard precautions on UP guidelines. UP guidelines include airways. Establish an airway breathing. Once you have an airway, determine effectiveness of breathing circulation. After ventilation, assess circulation disability. Determine PT's level of consciousness exposure. Determine PT's exposure to adverse elements. When a pint is bleeding, you should determine source of bleeding, apply direct pressure, do not remove object if internal bleeding may need to administer fluid, blood replacement surgery. Fracture splinting. Assess site for swelling, deformity, skin integrity, assess temp, distal pulses, mobility, apply splint, cover open areas with sterile cloth, reassess neurovascular after splinting. Heat stroke must be identified quick, treated aggressively. S&S, hot, dry skin, hypotension, tachypnea, tachycardia, anxiety, confusion, weird behavior, seizures, coma. Treat by rapid cooling, remove clothing, ice packs on oxylate, chest, groin, neck, cold water bath. Frost nip doesn't lead to tissue injury, treated with warming. Frostbite. S&S, white, waxy areas of exposed skin, tissue injury, full or partial thickness, warm to 38 to 40 degrees Celsius. Provide pain meds, administer tetanus vaccination. Burns. Cover PT, NPO status, elevate their extremities, preform head to toe, estimate area of effectiveness, administer fluids, tetanus toxoid. How to treat altitude-related sickness. O2, go to lower altitude, provide steroids or diuretics. BLS stands for Basic life support main part of CPR. Bathtub safety for babies. Parents should never leave their infant or toddler alone in the bathtub. Even if they can sit up on their own, they are not necessarily safe. To develop a plan of care. What is your primary goal in performing a comprehensive physical assessment? A brief thump felt near the 4th or 5th intercostal space near the left midclavicular line. While performing a cardiovascular assessment, you might encounter a variety of pulsations and sounds. Which of the following is a normal sounds? Identified a minty scent. While examining your patient's head and face, you determine that cranial nerve 1 is intact when the patient follows your right lower quadrant. Over which abdominal quadrant are vowel sounds most active and therefore easier to auscultate? Inspection. When performing a complete head-to-toe assessment, which physical assessment technique should you perform? Insert earpieces at an angle toward your nose. When using and maintaining your stethoscope, it is important to kyphosis. You are performing a physical examination of the spine for an adult. Which of the following findings is common in an older adult? Dorsal pedis. When assessing peripheral vascular status of the lower extremities, you place your fingertips on your patient's great toe and those of the toe next to it. Which pulse are you palpating? Crackles. When performing a respiratory assessment, you auscultate wet popping sounds at the inspiratory phase of each respiration as rebound tenderness. While performing an abdominal assessment, you place your fingertips over the patient's painful area and gradually increase the pressure. Patient reports increased pain on release of pressure. You document that your patient has positive balance. While performing a head-to-toe assessment, you perform the Romberg test. You do this to test the patients. They have a normal in-range BMI. As part of your general survey, you find that your patient has a body mass index of 23. From the finding, you determine that C. You should have a fecal occult blood test every year. A nurse is reviewing the medical records of a client who has a pressure ulcer. Which of the following findings should the nurse expect? A. Albumin level of 3 grams per deciliter. B. HDL level of 90 milligrams per deciliter. C. Norton scale score of 18. D. Braden scale score of 20. A. Albumin level of 3 grams per deciliter. D. Assist the client to an upright position. A nurse is giving a change of shift report about a client he admitted earlier that day who has pneumonia. Which of the following pieces of information is the priority for the nurse to provide? A. Admitting diagnosis. B. Breath sound. C. Body temperature. D. Diagnostic test results. B. Breath sounds. A. Gently shake the container of medication prior to administration. PT should be in the high Fowler's position when administering medication. A nurse is caring for a client who has an indwelling urinary catheter. Which of the following assessment findings indicates that the catheter requires irrigation? A. Urine has an unusual odor. B. Urine specific gravity is 1.035. C. Bladder scan shows 525 milliliters of urine. D. Urine is positive for ketones. C. Bladder scan shows 525 milliliters of urine. D. Use a clock pattern to describe food on the client's plate. B. Apply intermittent suction when withdrawing the catheter. A. Walking briskly. Obtain the pronouncement of death from the provider. Remove tubes and indwelling lines. Wash the client's body. Ask the client's family members if they would like to view the body. Place a name tag on the body. A. I can concentrate best in the morning. A nurse is calculating a client's fluid intake over the past 8 hours. Which of the following items should the nurse plan to document on the client's intake and output as 120 milliliters of fluid? A. 2 cups of soup. B. 1 quart of water. C. 8 ounces of iced chips. D. 6 ounces of tea. C. 8 ounces of iced chips. C. I'll check the wires and cables on my TV to make sure they are in good working order. Oxygen is a highly flammable gas. The visitors should smoke outside the house. D. Administer pain medication 45 minutes before changing the client's dressing. C. Use progressive relaxation techniques at bedtime. D. Check the IV tubing for obstruction. A nurse is assisting a client who is post-operative with the use of an incentive spirometer. Into which of the following positions should the nurse place the client? A. Sideline. B. Supine. C. Semifowlers. D. Trendelenburg. C. Semifowlers. A. We can talk about advanced directives and I can also give you some brochures about them. A. Erythema on pressure points. C. Swelling and coolness are observant foresight. C. I flushed what I urinated at 7 a.m. and have saved all urine since. D. Acupuncture. A nurse is preparing to transfer a client who has right-sided weakness from the bed to a chair. In what order should the nurse take the following actions to assist the client? 1. Ask the client if he can bear weight. 2. Position the chair on the left side of the bed. 3. Have the client sit and dangle his feet at the bedside. 4. Use the stand and pivot technique to move the client to the chair. A nurse is caring for a client who has pharyngeal diphtheria. Which of the following types of transmission precautions should the nurse initiate? A. Contact. B. Droplet. C. Airborne. D. Protective. B. Droplet. A. Ask another nurse to observe the medication wastage. D. Bruises on the arms in various stages of healing. A nurse is caring for a client who has a prescription for 5 units of regular insulin and 10 units of NPH insulin to mix together and administer subcutaneously. Determine the correct order of steps for this procedure. C. It might help me to listen to music when I'm lying in bed. B. Determine the reasons why the client is refusing to use the incentive spirometer. A. Examine personal values about the issue. A nurse is reviewing a client's medication prescription which reads digoxin 0.25 by mouth every day. Which of the following components of the prescription should the nurse question? A. The medication. B. The route. C. The dose. D. The frequency. C. The dose. A. Clean sutures along the incision site. D. Have the client use a trapeze bar when changing position. A. Pat the client's wrist before applying the restraints. A nurse has accepted a verbal prescription for 0.3 milligram of levothyroxine Forstet for a client who has myxedema coma. How should the nurse transcribe the dosage of this medication in the client's medical record? A. 0.3 milligrams. B. 0.3 milligrams. C. 0.30 milligrams. D. 0.3 milligram. B. 0.3 milligrams. A. Assist the client with a partial bed bath. B. Measure the client's BP after the nurse administers an antihypertensive medication. D. Use a communication board to ask what the patient wants for lunch. A nurse is caring for a client receiving fluid through a peripheral forecatheter. Which of the following findings at the IV site should the nurse identify as infiltration? A. Purulent exudate. B. Warmth. C. Skin blanching. D. Bleeding. C. Skin blanching. Undersize planning teaching for a group of adolescents of age recently had surgical placement of an ostomy. Which of the following message to the nurse use as a psychomotor approach to learning? A. Role play. B. Group discussion. C. Question-answer meetings. D. Practice sessions. D. Practice sessions. D. Flush the tube with 15 milliliters of sterile water. B. Make sure the client wears a mask out when outside of her room if there is construction in the area. A. Allow extra time for the client to respond to questions. C. The client holds the cane on the stronger side of her body. D. People in middle adulthood often find satisfaction in nurturing and guiding young people. A nurse is caring for a client who has said his diet prescription changed to a mechanical soft diet. Which of the following food items should the nurse remove from the client's breakfast tray? A. Tomato juice. B. Banana slices. C. Pancakes. D. Fried egg. D. Fried egg. B. Regulate oxygen via nasal cannula at a flow rate of no more than 6 L. B. They indicate the form of treatment the client is willing to accept in the event of serious illness. A. Thread the IV catheter so that the hub rests at the insertion site. A nurse is assessing a client who has been on bed rest for the past month. Which of the following findings should the nurse identify as an indication that the client has developed thrombophlebitis? A. Bladder distension. B. Decreased blood pressure. C. Calf swelling. D. Diminished bell sounds. C. Calf swelling. A. During admission process. B. The pain is like a dull ache in my stomach. C. An uneven shape. A. Press gently on the tragus of the client's ear. A. The nurse opens the sterile field on the wet surface. D. Are you able to help with your hygiene care? C. Decrease in heart rate. D. If family members wear a gown and gloves when visiting. B. We will apply oxygen through a tube in your nose. A nurse is assessing an older adult client's risk for falls. Which of the following assessments should the nurse use to identify the client's safety needs? A. Lacrimal apparatus. B. Pupil clarity. C. Appearance of bulbar conjunctiva. D. Visual fields. E. Visual acuity. B. Pupil clarity. D. Visual fields. E. Visual acuity. A nurse is caring for a client who has a sodium level of 125 mg/L. Which of the following findings should the nurse expect? A. Numbness of the extremities. B. Bradycardia. C. Positive Fostek sign. D. Abdominal cramping. D. Abdominal cramping. D. Reassure the client that this is an expected response to grief. A. When descending stairs I will first shift my weight to my right leg. B. Place the client's arm in a dependent position. A. Second intercostal space at the left sternal border. D. Stand close to the cabinet when lifting. D. A client who has asthma. D. A client who has an 4 infusion pump receives an additional 250 milliliters of 4 fluid. C. I am available to talk if you should change your mind. A. Use the complete name of the medication magnesium sulfate. D. Is your pain sharper or dull? B. Wrap monitoring cords with stockinette and tape them in case. C. Insert the IV catheter without using a tourniquet. D. Have the client take sips of water to promote insertion of the NG tube into the esophagus. B. An X-ray shows the end of the tube above the pylorus. A nurse is admitting a client who has an abdominal wound with a large amount of purulent drainage. Which of the following types of transmission precautions should the nurse indicate? A. Protective environment. B. Airborne precautions. C. Droplet precaution. D. Contact precautions. D. Contact precautions. A client who is non-ambulatory notifies the nurse that his trash can is on fire. After the nurse confirmed the fire, which of the following actions should the nurse take? A. Activate the emergency fire alarm. B. Extinguish the fire. C. Evacuate the client. D. Confine the fire. C. Evacuate the client. C. Cleanse the wound from the center outward. B. Place a client who has tuberculosis in a room with negative pressure airflow. C. Remove the stockings at least once per shift. B. A 16-year-old client who is married. C. A 27-year-old client with schizophrenia. D. An adoptive parent who brings in his 8-year-old son. E. A 17-year-old mother who brings in her toddler. B. Tell the client to keep the head of the bed elevated at least 30 degrees. B. Notify the nurse manager. A. Place the client in a room with negative pressure airflow. B. Wear gloves when assisting the client with oral care. E. Use antimicrobial sanitizer for hand hygiene. A. The client, unaware of her recent cancer diagnosis, asks the nurse if she has cancer, and the nurse responds affirmatively. A. Check the client for injuries. A nurse is teaching a client about dietary management of hypercholesterolemia. Which of the following foods should the nurse suggest the client add to his diet? A. Beef liver. B. Shellfish. C. Egg yolks. D. Avocados. D. Avocados. C. Roll overload. A nurse is administering 4 fluid to an older adult client. The nurse should perform which priority assessment to monitor for adverse effects? A. Auscultate lung sounds. B. Measure urine output. C. Monitor blood pressure reading. C. Monitor serum electrolyte levels. A. Auscultate lung sounds. A. Narrowed arterial lumen. A nurse is completing an admission assessment for a client who reports vomiting and diarrhea for the past 3 days. Which of the following assessment findings should the nurse expect? A. Neck vein distension. B. Urine specific gravity 1.010. C. Rapid heart rate. D. Blood pressure 144/82 mmHg. C. Rapid heart rate. A. What could I have done to deserve this illness? C. Subtract the amount of irrigant use from the client's urine output. B. Withhold the blood transfusion. A nurse is reviewing a client's fluid and electrolyte status. Which of the following findings should the nurse report to the provider? A. BUN 15 mg per deciliter. B. Creatinine 0.8 mg per deciliter. C. Sodium 143 mcl. D. Potassium 5.4 mcl. D. Potassium 5.4 mcl. A nurse is admitting a client who has varicella. Which of the following types of transmission precautions should the nurse initiate? A. Airborne. B. Droplet. C. Contact. D. Protective environment. A. Airborne. B. This is a difficult time, but we are helping each other through this. D. Initiate an enteral feeding through a gastrostomy tube. B. A nurse asks a nurse from another unit to assist with her documentation. B. Select a suction catheter that is half the size of the lumen. C. Have the client stand with her arms at her side and her feet together. A nurse is preparing a change of shift report. Which of the following tools or documents should the nurse use to communicate continuity of care? A. Critical pathway. B. Situation, background, assessment, and recommendation. C. Transfer report. D. Medication administration record. B. Situation, background, assessment, and recommendation. C. The family member washes out the feeding bag with warm water once every 24 hours. B. Elevate the head of the client's bed. A nurse is caring for a client who needs to maintain a positive nitrogen balance for wound healing. Which of the following food items should the nurse recommend as a good source of complete protein? A. Oat cereal. B. Refried beans. C. Peanut butter. D. Cheddar cheese. D. Cheddar cheese. D. I will be sure to remove my hearing aid before taking a shower. A. Talk directly to the client instead of the interpreter when speaking. A. Administer the medication with the needle at a 45-degree angle. C. Client found lying on floor. A nurse is planning care for a client who has fluid overload. Which of the following actions should the nurse plan to take first? A. Reduce dietary sodium. B. Administer a loop diuretic. C. Evaluate electrolytes. D. Restrict intake of oral fluids. C. Evaluate electrolytes. A. Check the cord routinely for frizz or tearing. C. Consider purchasing a generator for power backup. D. Observe for signs of hypoxia. B. Wash your hands before and after contact with the client. B. Use tracheostomy covers when outdoors. C. Make sure 2 fingers can fit under the sleeves. D. We need to document the exact medication you were taking because you might be allergic to it. D. Compare prescriptions with medications the client received during hospitalization. C. Assess the client for orthostatic hypotension. A. Wrap blankets around all 4 sides of the bed. A nurse in a nutritional clinic is calculating body mass index for several clients. Which of the following BMI represent an overweight client? A. 24, B. 30, C. 27, D. 32. C. Overweight is defined as an increased body weight in relation to height, indicated by a BMI of 25-29.9. Chapter 3. A nurse on an orthopedic unit is reviewing data for a client who sustained trauma in a motorcycle crash. Which of the following values indicates the client is in a catabolic state? A. Serum albumin 3.5 grams per deciliter. B. Negative nitrogen balance. C. BMI of 18.5. D. Serum prealbumin 15 milligrams per deciliter. B. Negative nitrogen balance. A nurse is performing a nutritional assessment on a client. Which of the following clinical findings are suggestive of malnutrition? A. Poor wound healing. B. Dry hair. C. Blood pressure 130/80. D. Weak hand grips. E. Impaired coordination. A. Poor wound healing. B. Dry hair. D. Weak hand grips. E. Impaired coordination. A nurse is teaching a group of women about risk factors for osteoporosis. Which of the following risk factors should the nurse include? A. Inactivity. B. Family history. C. Obesity. D. Hyperlipidemic. E. Cigarette smoking. A. Inactivity. B. Family history. E. Cigarette smoking. C. Recommending one's own favorite foods. C. The preparation of foods using sodium places the client at risk for hypertension. Many spices in the Asian diet contain sodium, or it is used as a preservative. Sodium consumption should be in moderation. B. Clients who practice Orthodox Judaism do not eat meat with dairy products. A nurse is caring for a client who follows a vegan diet. Which of the following foods should the nurse offer the patient? A. Bagel with cream cheese. B. Fried egg. C. Fruit with yogurt. D. Wheat toast with peanut butter. D. Wheat toast with peanut butter. A. Reassess the client to determine the reasons for inadequate pain relief. A. Assessment. ARR is 22 per minute with even, unlabored respirations. D. Skin is pink, warm, and dry. E. The assistive personnel reports the client walked with a limp. C. Showing a client how to use progressive muscle relaxation. D. Performing a daily bath after the evening meal. E. Repositioning a client every 2 hours to reduce pressure ulcer risk. A. I will determine the most important client problems that we should address. A. Basic. B. Responsibility. B. The client is non-adherent with coughing, deep breathing, and dangling. C. The client may have pain medication every 4 to 6 hours but accepts it every 6 to 7 hours. E. The client's vital signs are heart rate 124/min, respiratory rate 22/min, temp 98.6 and blood pressure 156/80. A. Knowledge. A nurse uses a head-to-toe approach to conduct a physical assessment of a client who will undergo surgery the following week. Which of the following critical thinking attitudes did the nurse demonstrate? A. Confidence. B. Perseverance. C. Integrity. D. Discipline. D. Discipline. A. Obtain culture specimens before initiating antimicrobial. C. Encourage the client to rest and limit activity. E. Assist the client with oral hygiene frequently. A. Do not measure the client's temp rectally. A. Place the client in semi-Fowler's position. B. Have the client rest an arm across the abdomen. C. Observe on full respiratory cycle before counting the rate. B. Perform a pain assessment. Would be the appropriate action to take next. A nurse is performing an admission assessment on a client. The nurse determines the client's radial pulse rate is 68/min and the simultaneous spica pulse rate is 84/min. What is the pulse deficit? 16 per minute. B. Reflecting. A. Use an open posture. C. Establish and maintain eye contact. E. Respond positively when giving feed. C. Your daily routines will be different when you get home. D. Tell me about your support system you'll have after you leave the hospital. E. Let me tell you about a friend of mine with a colostomy who enjoys swimming. B. Encourage the client to communicate his thoughts and feelings. A nurse is caring for a school-aged child who is sitting in a chair to facilitate effective communication. M. Which of the following actions should the nurse take? A. Touch the child's arm. B. Sit at eye level with the child. C. Stand facing the child. D. Stand with a relaxed posture. B. Sit at eye level with the child. B. Ask the family one question at a time. D. Use lay terms if possible. E. Do not interrupt the interpreter and the family as they talk. C. The same religious beliefs can influence individuals differently. C. Provide quiet times for these moments. B. I will discuss the daily schedule with the client to make sure the client will have time for prayer. D. Let's discuss the necessity for a blood transfusion with your religious and spiritual leaders and come to a reasonable solution. Which product affect the permeability of gloves?